All right, let's talk about a medication a lot of people know or have at least heard of. Alprazolam, which most of us know by its brand name Xanax. It's one of the most widely prescribed anti-anxiety drugs out there, but it also comes with a ton of questions and some really serious concerns. So if you're taking it, or even just thinking about it, you're in exactly the right place to understand this powerful drug a little better. So let's just get right to it and tackle the big question head on. Is this medication actually safe for you? The fact that you're even asking that question shows that you're being really thoughtful about your health. And that's a completely valid, super important concern that we're going to unpack together in this explainer. Okay, so first things first, to really understand the risks, we have to understand the promise. How does this medication actually work its magic? What's it designed to do inside our brains that brings about that feeling of calm? Well, alprazolam is part of a family of drugs called benzodiazepines, or benzos for short. This is the same class as other medications you might have heard of, like lorazepam, Ativan, or diazepam, Valium. And they all pretty much do the same thing. They act as a sedative on your central nervous system. Now, how they work is actually pretty cool. It all comes down to a chemical that's already in your brain called GABA. The easiest way to think about GABA is as your brain's natural brake pedal. Its job is to slow things down, to pump the brakes on all those signals that can start firing too fast and spin out of control into anxiety or even a full-blown panic attack. So the process is pretty straightforward. Your brain is getting flooded with these overexcited anxiety signals. Alprazolam comes in and basically gives that GABA a huge boost, making it way more effective. This slams down on the brain's brake pedal, which is what leads to that feeling of relaxation, calm, and even sleepiness. So doctors usually prescribe it for a few key reasons, mainly severe anxiety and panic attacks. But it's also used for what's called off-label reasons, things like intense one-off situational anxiety, a crippling fear of flying or feeling claustrophobic during an MRI scan. And sometimes it's even used for things like insomnia or nausea. And that, of course, brings us to the other side of this double-edged sword, the peril. It's so important here to make a distinction between side effects that are just kind of annoying and risks that are genuinely seriously dangerous. Now, most people who take it are going to experience some of the common stuff. You might feel drowsy, a bit dizzy, or just have this kind of cloudy or foggy feeling in your head. Lack of coordination, dry mouth, and even some temporary trouble forming memories are also on the list. And yeah, these are definitely unpleasant, but they usually go away once you stop taking the medication. But, and this is the part where we really need to pay close attention, there are other risks that go way, way beyond just being bothersome. These are the real dangers that demand our full respect and understanding. Just look at this number for a second. 6 weeks. Physical dependence on alprazolam can start to develop in as little as 6 weeks of taking it regularly. That is an incredibly short amount of time. And here's the trap. Here's how it happens. Because alprazolam is so good at what it does, your brain starts to adapt. It says, hey, I don't need to make so much of my own calming GABA anymore. And that's dependence. Soon, you need more of the drug to get the same relief. That's tolerance. And then, if you try to stop, your brain completely freaks out, and that's what triggers withdrawal. And withdrawal from alprazolam can be absolutely brutal. We're talking about rebound anxiety that's often way worse than what you started with, horrible insomnia, wild mood swings, and in the most severe cases, it can even cause seizures. It's known for being one of the toughest benzodiazepines to quit. On top of dependence, long-term use is tied to some really serious memory issues. The drug can literally get in the way of your brain's ability to form new memories. And research shows these cognitive problems can stick around for months after stopping, and in some cases, the damage might even be permanent. And here's a really powerful way to think about the risk, even with short-term use. You have to treat this medication exactly like you would alcohol. It slows down your reaction time, it messes with your coordination, it impairs your judgment. Driving while on alprazolam is every bit as dangerous and just as illegal as driving drunk. Period. This brings us to the most lethal danger of all, overdose. The risk just skyrockets when alprazolam is mixed with other things that slow your body down. Combining it with alcohol, or even more dangerously, with narcotic pain medications like opioids, is a recipe for disaster and one of the leading causes of accidental overdose deaths. Please, never, ever mix these substances. Okay, so after hearing all those dangers, you might be wondering, well, is there any safe way to use this medication?
And the answer is yes, but it requires a very, very careful and deliberate approach. So let's shift from the perils to the path forward and talk about a framework for safer use.
This is really the core question to talk about with your doctor. When used in the right circumstances and with really strict guidelines, alprazolam can be an incredibly helpful tool. The whole key is understanding what those specific circumstances are. So the principles for safe use are actually pretty clear. It can be a lifesaver for those occasional intense situations, like stopping a panic attack dead in its tracks or getting you through that flight you're terrified of. The most important rule is to avoid taking it every day. Do not rely on it for sleep. And, I'll say it again, absolutely never mix it with alcohol or other sedatives. And let's just zero in on that sleep issue for a second, because it's such a common misuse. It's a really bad choice as a sleep aid for three main reasons. First, it wears off too fast, so it might help you fall asleep, but it won't keep you asleep. Second, it messes up your natural sleep cycles, so you're not getting that deep, restorative sleep your body needs. And third, using it every night is the absolute fastest way to become dependent. So, if you're going to remember just one thing from this entire explainer, let it be this. Alprazolam is a powerful tool. It's a rescue medication for occasional, short-term relief. It was never designed to be, and it should never be treated as, a long-term daily solution for anxiety. Ultimately, all this is meant to start a conversation, not give you a conclusion. Is this powerful tool the right choice for your specific life and your specific situation? That is a question that can only be answered carefully, thoughtfully, and in partnership with a doctor you trust. And of course, I have to say, please remember that this is for educational purposes only. It is not a substitute for real professional medical advice. Always, always talk with your doctor or another qualified healthcare provider if you have any questions at all about a medical condition. Thanks so much for your time.